We had a guy in today who said, I had a clean bill of health in April, and in September, I'm having quadruple bypass. Well, clean bill of health based on those few tests that the doctor did. Those aren't all the tests. Had they run a few of the extra tests like we run, you'd pick up on those things. The new test that a lot of doctors do is the calcium. They'll look at in this gentleman's case, we'd taken an x-ray of his lower back, and you can see his whole aorta. That's the major blood vessel that brings blood back from your feet back up to your heart. You shouldn't see that on an x-ray. X-rays look at bone. So why am I seeing his aorta? It's calcifying. So one of the tests they use is a new CT scanner that looks at calcium blockage, and it's a hard plaque or soft plaque. Are your arteries turning into bone, in which case you have significant coronary artery disease, or is it softer plaque, in which case that doesn't occur that way? Well, let me just tell you, if I can see your aorta on an x-ray, it's hard, and you have a significant problem, of which they put the stents in. He's still 320 pounds, so they didn't fix his diet, they didn't fix his exercise, they didn't reverse the metabolic, they didn't change how he eats or give him supplements, so his body's still doing the same thing. And I'm like, you're gonna have another one because the original conditions are still there. They bought you some time, right? But they didn't put out the full fire, so it's coming back because the cause is still there. That's what we do with the Vitamin. That's what we do at the Pain Relief and Wellness Strategy Center. That's why we're experts in what we do. Many patients say, how did you come up with all this in just a few minutes of meeting you? And I've been going to doctors for the better part of a year. They call it the expert effect. Because we have so many tools and so much experience and seen so many patients, and because we have so many diagnostic tools beyond the standard what most doctors do, because we have treatment options beyond what most doctors do, we have a breadth of experience and expertise that we can see things that other doctors or chiropractors often don't see, or if they did, they wouldn't know what to do with it because that's just not part of what it is they do. Like they don't have this tool over here and used it 10,000 times to know what the result of that is in conjunction with this tool over here, in conjunction with modifying maybe a lifestyle over here, put all that together, pretty predictable results, which is why we always do frequent reevaluations to chart the progress. We redo the blood work to see the changes to make sure that what we think is happening is actually happening. And if it is happening, which it is, then you actually get better. And not only do you feel better, but we can show you the test results. We can show you the post images to show you that things are healing so that you not just feel better, you are better. And that way you don't have to worry, is this thing coming back down the pipe in 6 months or a year or 5 years? Feel free to reach out, maybe ask for a copy of our book, come to a workshop or a seminar that we give here at the clinic. Ask to have a no-charge evaluation. For over 35 years, we decided there's never been a charge for an initial evaluation. It's a full evaluation because we felt that everybody deserved. I actually worked for my first mentor. His clinic was called the We Care Clinic, where everyone can afford a routine evaluation. And we'd have patients ask, do you take my insurance for this or that? And the insurance thing became such a question and dissuaded some people whether their insurance would cover this or that. We just said, you know what, let's remove the entire question altogether. Let's remove that barrier. There is no charge. We do what we do. We find what we find. We report our findings to you, and then you decide if you wish to fix it or not fix it. Of course, they verify your insurance to see what is or isn't covered, but I just let you know up front, drugs and surgery are covered by insurance. Anything that's not a drug or surgery is typically not. We know that drugs and surgery have their place, but that's in 1 to 4% of cases. The rest of the cases are functional in nature. They're not going to do much.